So loneliness among older adults is a growing public health issue that poses significant health risks. As the older population increases and family structures change, many developed countries are facing the issue of social isolation and loneliness and trying to tackle it. The US faces a similar issue, and in 2017, the US Surgeon General identified loneliness as a major public health concern.
We're comparing Japan and the US in their policies, their programs, and their services that aim at helping older adults who are suffering from social isolation and loneliness.
So I think that a lot of our results will show that COVID-19 has brought light to the issue of social isolation, especially among older adults, since it was really bad in nursing homes, and these are people who have already been socially isolated, and now everyone else is feeling socially isolated. So it's kind of like, oh, okay, this is probably an issue that we should all focus on now.
I think we're going to see a lot of results regarding an increase in both the feeling of loneliness and the effects of it towards like mental health. I think that a lot of this is going to show the importance of focusing on older people and older generations, and intertwining younger generations with the older generations, just because we've kind of been shoving a lot of that under the rug in regard to policy and essentially the steps that we have to take care of our older generations.
A lot of the key informants that we have interviewed have been asking for our results so that they can use what we've heard to better Fairfax County and other Northern Virginia municipalities, their actions and types of services that they offer to the community now, and they can gauge how they've been doing. So I think people are excited to learn about their impacts on the community and how they can get better.
It has to do a lot with looking at caring for humans and people that they're going to work with and understand how they feel. And I think that's very important for any job or any field, the human connection and trying to understand who you're going to impact with your work.
What people forget is that all these majors they all deal with human subjects. With this study, it really helps them to understand how to respect human subjects, how to educate yourself on them, how to speak to them in different situations.
Yeah, my team has definitely does have a diverse majors and fields that they want to work on. The majors and even interests in what field they want to pursue all overlap.
It's actually very exciting. I work with people in the anthropology program and social work, and so it kind of gives me a new perspective on aging, on behavior, because before I thought that only psych majors or neuroscience majors could relate to the things that I was studying and learning, and now knowing that I have friends who study gerontology on a different level, in anthropology, it brings it all full circle and lets me know that okay, like we can sit down and have a conversation about these things without being in the same major.